one older patient. She was 74, 75 years old. No, she was almost 80, 79. Severe rheumatoid arthritis. Came into the office and having problems with the medications. I mean, she's kind of frail and her knees or joints are all bent up and everything. And, she said, look, I can't afford your detox. I said, really? I said, well, what's your monthly budget? She says, $50. Weekly budget, $50. And so I went with my wellness manager, said, look, she needs to be on a smoothie feast detox. I want you to create a smoothie feast that for $50 a week where it meets her budget and we make a profit. And she did that. The patient came in, started doing smoothie detoxes week after week after week. We noticed this frail old 79-year-old lady, after about 2 or 3 weeks, was starting wearing makeup. She was coming in. She used to have somebody drive her. Then she was driving herself. She would come in, grab the large bottles of smoothies herself, walk out. She went from walking with a cane, without a cane, etc. Now, we could have sat around and made excuses and felt sorry for her, but we didn't want to do that. She didn't want to do that. We said, look, what is the plan? If you're determined to do this, we're determined to help you. What are the obstacles? Let's make this work. And so, and that's why we got into the whole business of getting into the food business. We have a restaurant in our side. We do raw detox because when I put patients on this diet, we couldn't control what they were eating, where they were going. So I said, we need to figure out how to do that. I didn't learn how to be a restaurateur in medical school, but I had to figure it out. So the same attitude I convey to my patients, I convey to myself. Whatever I need to do to figure it out, to be better, be a better physician, because I noticed many of my patients, they didn't need a cardiologist, they needed a chef. So I became a chef and we put in the restaurant. Now we expanded into the grocery business. We're actually connecting with local growers. We're doing what it takes to be a better healthcare facility for our patients, locally, nationwide, wherever the case may be. And we're asking our patients to be innovative. Sometimes I'll challenge a patient, not for their own benefit. I may see an elderly person who has various other issues. I say, ma'am, you're not doing this for yourself. You're doing this for many other people who are waiting for you to succeed so that I can then tell your story so then they can succeed. When they hear that, that motivates them to make the extra step. It's all about mindset. Once you change the mindset, everything else becomes process tactics.
I want to go back to the patient that you were talking about with COVID-19 at the top of the interview for those who are just now joining the interview. If you could just kind of walk us through again, the audience is substantially bigger, and what you were able to do with this gentleman when he first presented and how you were able to treat him.
Yeah, so this gentleman was one of our patients, congestive heart failure, has some cardiac arrhythmias. We began working with him by telephone visit. And so he was having fevers and headaches at home. And so we put him on a raw detox. We put him on raw smoothies, salads. We had him on some vitamin supplements. We had him on a grapefruit seed extract, nutrient immune booster for a few days. And we had him go through the process, keep himself hydrated, et cetera. And the symptoms persisted for about 8 days as he was an outpatient. He wasn't getting worse, but he really wasn't getting better to any noticeable degree. Because of that, I said, well, I'll tell you what, go to the emergency room. Let's evaluate you in the hospital. He did go to the emergency room and they called me. They had done a chest x-ray. He had double pneumonia. His oxygen saturation was 93% at room air, which wasn't too bad given he had double pneumonia. So he was never really given supplemental oxygen. They tried him on it, went up to 98%, but we admitted him to the ward, to the CCU. We observed him there. His oxygen had picked up by that point. He was later transferred to a special part of the hospital where they managed the COVID patients in our hospital. But he was only there for about 5 days. So he had about a 13-day course. During the hospital, he became afebrile within about the second day. He only had a low-grade fever by the time he was in the hospital. I think his fever was up to 102, 101 at home. It had gotten to maybe 100, 101 in the hospital, had gone down after that. But his condition, really, his body was fighting the virus throughout the whole process. he remained nourished. He remained on a raw diet, smoothies, salads, juices. And so his immune system was being enhanced. Just think of it this way. If you have two countries fighting each other, country A and country B, and they're shooting bombs and the like, and you want country A to win, you're going to then send bombs and weapons and maybe even soldiers over to country A to support their fight. Now, there may be a bit of a standoff, but the more weapons you send to country A, they will eventually prevail. That's what it is with your immune system. The virus is trying to take over and replicate. The immune system trying to overcome the virus. The more you feed the immune system during that time, during that fight, vitamin C, vitamin A, zinc, raw fruits and vegetables, hydration, sleep, the more you feed the immune system during that fight, the immune system will eventually prevail. That's even during the infection. So we tell our patients before you're infected or even during your infection, raw fruits and vegetables, detox, supplement vitamin C if needed, zinc is needed. We have a regimen we recommend. And you want to enhance your immune system's ability. That's your ultimate battle against this virus. So this individual, he recovered. He was confirmed COVID positive. He had a follow-up test. He was negative. And we're going to do the antibody test to confirm his IgG immunity. But he's doing great. He's out, walking, running. He's having a great time, since he's now defeated the virus.
Dr. Baxter Montgomery dropping some inspiration and a whole lot of knowledge with us here at the virtual Fairfax Veg Fest, brought to you by Green Fair Organic Cafe, a plant-based diet, Mom's Organic Market, and of course the Evolution Vegan Academy. Have you been working, Dr. Montgomery, with any other COVID patients, or was this your one and only case?
He was the most significant case. We've had a number of mild cases that they had mild flu symptoms and just got better. A handful of them were positive, but again, they didn't go to the hospital. He was our one patient went to the hospital. What I will say is this, and you asked the question, you've been working with COVID patients. I consider anybody at risk for catching the COVID virus a COVID patient. And so we systematically place all of our patients on a detox. So we have a regimen, we email blast to them. We encourage them all the time to do detoxes periodically. A detox is a therapeutic tool. It's one thing that we use for patients to initiate getting on a plant-based diet, but a detox is something that patients should do on a regular basis. If you have diabetes or high blood pressure or heart disease, we know that people are not perfect. They should do intermittent detoxes, raw fruits and vegetables only for 4 weeks. So with our other patients during this flu pandemic, we recommend they go on a detox initially, then stay on a clean plant-based diet, take supplements, exercise. So we're treating our patients prophylactically to suppress the infection or to suppress extended illness if they were to get infected or colonized.
One of the questions that we've gotten asked repeatedly on the exam room recently is, have there been any studies done on the diets of patients with COVID-19? The answer to that question right now, to the best of my knowledge, is no. But in your estimation, just give me a hypothesis. Would you say that among COVID-19 patients, if there was such a study, it would say that the number of them who were eating exclusively a plant-based diet would be very low compared to those eating that standard American diet?
Well, I mean, I would guess, and I'll put it this way. Patients who are ill with COVID infection have underlying diseases, chronic illnesses, heart failure, diabetes, and the like. We know that an unhealthy diet potentiates those illnesses. So I would just make the extrapolation and say, yes, in all likelihood, the people who are sick with underlying illnesses are likely eating an unhealthy diet.
All right. Now, I know that this was supposed to be a big old in-person festival here, but circumstances being what they are, Gwen has worked very hard with her team, worked tirelessly to turn this into the virtual Fairfax Veg Fest. Nonetheless, I understand that you still have some slides there, a presentation that you would still put together for this very event.
Well, sure. Let me share my screen. I'm not going to bore you with my 10,000 slides that I have here, but I'm gonna I'm going to bring up a few slides and just show a few things as show and tell. What I want to do first and foremost is, hold on a second here. Okay, can you see that okay?
Yes, sir.
Okay, I'm going to go to full screen and wait a minute here. Let me go back to the beginning. And I'm just going to go forward through a number of slides. What I like to do is share with the audience our general approach. And I think it's important to understand, okay, exactly what do we do here? And I'm not going to spend too much time. This is part of an elaborate presentation, or I should say more elaborate presentation that I do. But when someone comes in as a patient, we make a general clinical assessment. So as any doctor's office, we have physical exams, biomarker testing, non-invasive testing that we do. Sometimes we take them to the hospital. Some patients are critically ill, so they have to have invasive procedures done. So we cover the whole spectrum is what I want to emphasize. And I like to describe our approach more as one as an integrative approach. The things that we do in modern medicine are necessary in many cases. I think where we frequently fall short is that we stop there. We don't encourage patients or treat patients with a nutritional regimen. So our approach, basically we have medication assessment. We look at a food prescription. So we start them on a nutritional regimen and we try to wean the medication. So it's really a three-part: clinical assessment, nutritional wellness assessment, and then the therapeutic approach is optimizing medications, which frequently is either weaning or reducing the number of medications, or maybe replacing some with medicines that are more effective, starting them on a nutritional regimen immediately, and then following them clinically over time. One little quick tidbit as I flip through these slides: there's a patient in our office, and while waiting in the lobby, he suffered cardiac arrest. And so I remember one of our front desk people came banging on my door, and there he was out. We started doing CPR, and we resuscitated him right there. The ambulance came, he came to, and you know, he's a heart failure patient, had been slipping on his diet and various other things. We were giving him ECP therapy, so we put him in the hospital. While in the hospital, you know, we did the initial evaluation, we did a heart coronary angiogram, he received the defibrillator, but while he was in the hospital, we initiated a detox regimen right then and there. So the reason I point that out is that it's an integrative approach. Just because he had a cardiac arrest and need to be resuscitated, we did that. But then after we resuscitated him, we said, look, you really need to detox in addition to the other things that we're doing. So that's really the philosophy behind what we're doing, because all of these therapies are important for that patient. Now, you'd like to have someone on detox and prevent the cardiac arrest, but you meet patients where they are, and where he was at that day was cardiac arrest, and we address that. This slide talks about a standard way of weaning medications. I'm not going to go over the details. I just want to show this slide just to point out the fact that there's a methodology, a standard protocol in which we use to wean medications. Weaning medications is very important. We see many patients on 20, 30 medications, and the polypharmacy is part of the disease state. The medications, for the most part, is only palliative, and many of them need to be reduced or removed, and the patient needs to rely on nutrition and other lifestyle measures to improve their overall well-being. I saw a patient in the office the other day. She's a lady we've been detoxing, we'd weaned off her antihypertensives and the like, and I saw that she was on an anxiolytic medication. I saw it there, and I said, well, are you still taking this? She says, I take it only once every 1 or 2 weeks. Because you told me to stop. And I said, well, are you still having anxiety? So no, I'll just take it if I feel like I'm going to have some anxiety. I said, well, just stop taking it. Don't rely on it. So the bottom line is that when the body becomes healthy, properly nourished, even emotional issues are under better control. I'm going to skip through a few slides, but I want to show this slide in particular. It's a busy slide. It's our food prescription nomenclature. So how do I truly prescribe food? We use a variety of things. We put them on raw detox, we put them on 0 to 6, some cooked foods, etc. We use intermittent fasting. So when I talk to one of my nutritionists, and I'm going to point to this top line here on the prescription examples, you see 4-20-5-2- parentheses 0 to 4B. Now there are 5 positions here. Position 1 denotes the duration of feasting. Position 2 denotes the duration of time duration of fasting. Position 3 denotes the days of intermittent fasting. Position 4 denotes the day of complete fasting. And position 5 denotes the food levels that they consume when they're feasting. So if a patient's on a 4-25-2 0 to 4B, on the intermittent fasting days, they're feasting for 4 hours. For the remainder of the day, they're eating nothing or drinking water. They do the intermittent fasting for 5 days. And on 2 days, they're just drinking water only. So it's a water fast. And then when they're feasting, they're eating at food levels 0 to 4B. So not only tells you precisely when you eat, when you're not eating, it tells you precisely the types of foods you eat when you're eating. Oftentimes people talk about intermittent fasting, and they may eat for 6 hours, and then the rest of them, they may fast for 20 hours and eat for 4 hours, but in the 4 hours they're eating junk. Well, it doesn't help you eat junk for 4 hours when you fast the rest of the day. So intermittent fasting should have feasting times where you're eating healthy food. And here's another example: feasting during 4 hours, fasting 20. They're doing that all 7 days. There's no days of water fasting, and they're doing level 0. Level 0 is smoothies and juices. So doing a smoothie feast. That lady I talked about earlier, she may have done an intermittent fasting, may drink smoothies for 4 hours, rest of the day water and sleep, and they do that every day of the week. So that's just an example of how we literally prescribe food as a level of precision that our nutritionist instructs the patient on how to follow this. Individuals with inflammatory conditions we have to be very aggressive and very precise with what they're doing. One comment I would make, I think with an earlier interview, the comment was made about an individual having 1 cheeseburger going to the emergency room. That's very true. Individuals, when you're on the detox regimen, you have 1 bite, 1 drop, 1 crumb can send you to the hospital. I had one patient who we were detoxing years ago, and he got off. He had maybe a couple of spoons of oyster soup. Within about 36 hours, he was intubated in the CCU. So these veering off when your body's clean, the body can overreact in a way that can make you very sick, especially if you're a very ill patient. I'm going to flip through some of these slides that shows some of the things that we do. Clinical follow-up is important. Frequent office visits, weekly office visits. Individuals who fly in from out of state will stay for 4 to 8 weeks, sometimes 3 months, go on one of our detox regimen. The food prescriptions, we go through modifications. Medication weaning is very, very important. Here's some of our data. We show that we can reduce cholesterol and blood pressure in the clinical setting in a matter of 4 weeks, while at the same time reducing medications. Some of these slides are busy. We did 31 subjects. Most were average age about 53. Most were female, 80% Black individuals. BMI was 37.5 on average. And they had a variety of chronic illnesses. So essentially, this slide shows our food prescription, food classification system. And this is how we define the food levels. I'm not going to go through the business of it. But the reason I'm showing you this slide to show you the level of precision and in terms of what we do in classifying the food. It's one thing to say eat a vegan diet, but when individuals go to the store, there are oils, processed foods, chemical preservatives, dyes. There are many things that are in the food that's not so ideal. I'm not going to spend time here. I do want to show we showed 30% reduction in inflammation. We even showed reduction in hemoglobin A1C in just 4 weeks, as well as reduction in glucose and cholesterol. Systolic and diastolic blood pressure was improved in this 4-week period of time. And we had a 40% reduction in medicine. You see here, the bar graph shows going from 2.6 medications per patient down to 1.6 at 4 weeks. And we were also the first to show the reduction in lipoprotein(a) in 4 weeks in using diet in the medical literature. And here's some slides. What I'll do is I'll go away from share. If you have any other questions, I do have a few slides on coronavirus, but I'll go ahead and give it over back to you.
Yeah, I just want to follow up. I definitely want to get to those slides. And by the way, if you're listening to this audio version of the podcast, you can head over to Facebook and go to the virtual Fairfax Veg Fest page and see the video for this. This will also be on the Physicians Committee's pages, so you can find it there as well. These are really enlightening slides, and you can see all of the numbers that Dr. Montgomery was glossing over, but in great detail. I want to go back to what it was you were talking about, that cheeseburger or the strong reaction to the oyster stew that you mentioned. I'm curious, not being a doctor, what I think is, and please tell me if I'm wrong, my guess would be this stuff has not been in your body for so long. When you ingest it, it kind of treats it like a foreign invader, and so your body just attacks it kind of. And is that what causes such a violent reaction in some people?
That's certainly a way to look at it. If you were to, and here's one way I've rationalized the thought and thought it through. Let's start from the very beginning, maybe at birth, et cetera. And even at then, we'll probably become accustomed to eating certain things. But let's say you eat cheeseburgers and fried chicken and pizza every day of your life. Now, these foods are foreign to your system. However, your body adapts to it. Now, it's a maladaptation, but it's an adaptation of sorts, to where you don't throw it up, you don't pass out. It may or may not raise your blood pressure. It will raise your blood pressure, but it does it in somewhat of a blunted effect because the body has to adapt to it. You may increase more fat cells. You may do a lot of things to adapt to these toxins that you're receiving on a regular basis. So you're accustomed to being in what we call an oxidative state. However, over time, you break down. So let's say you go through a process where you clean your system out. You remove these toxins, because when you remove bad foods from your diet, the body is constantly trying to remove toxins from tissue levels, at the cellular level, intracellular level. There are chemicals and things that it's trying to move out all the time. But because you're constantly replenishing it, it's hard to have a net removal. But if you stop introducing these chemicals to the body, then you have a net reduction of chemicals, a net reduction of reactive oxygen species, a net reduction of free radicals and the like, and you're suppressing them with these antioxidants. So over time, as you're removing these things, the body starts to heal. Now, there's some process by which the body becomes extra sensitive to these foods once they're removed, because it's almost like having 10 receptors, and then you put a chemical in to suppress those receptors, and you go down to your body makes an extra 10 or whatever the case is, and you remove the chemical, you got 20. So you become extra sensitive to whatever that chemical is. And it's like this. And the same thing with someone who's detoxing on something else. So you remove these chemicals, and all of a sudden it's reintroduced. You have a greater sensitivity than you've had all along, because in the chronic state, your sensitivity has been suppressed. Once you've healed, your sensitivity is greater, and your body recognizes this to be the poison that it is.
Man, y'all think that this is nutrition 101? No, 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 no. This is graduate level. This is like 302. This is like PhD, MD. Like this is legit knowledge that is being dropped right now. Thanks for taking us to school. I really appreciate that.
No problem. My pleasure.
Before we get back to COVID, I think that something that a lot of people might be wondering is you've worked with so many patients for so long now. Is there one case of heart disease that you saw that was just so advanced, and even you were surprised that you were able to see a reversal of after this person had implemented a diet change?
You know, it's I'll present it in the reverse. We've had a few cases where I'm surprised that they're able to walk into the office. I've gotten to the point where I'm not so surprised about the recovery. I'm just surprised how some people can exist on the type of foods they're eating, the foods they're not eating, the medications they're taking, the age they have. And I'm just frequently amazed of that, the people that are still around. We have patients with, heart failure, liver failure, kidney failure. There's one patient in the hospital, to answer your question more directly. There's one patient I treated years ago in the hospital, and she was a patient I had implanted a defibrillator on. She had chronic lung disease. So she had chronic lung disease or lung failure, congestive heart failure. She was developing liver failure while in the hospital. She was intubated, and her kidneys were about to fail. So multi-organ dysfunction / failure, and her family had refused dialysis. So if it didn't allow us to dialyze her, she was going to die. So I talked to the family, said, look, let me try some things. And they agreed. So she had a peg tube, a feeding tube going through her stomach. So I started giving her green superfoods, liquid superfoods through her peg tube. And at the same time, I discontinued the other, I think they had it on intravenous feeds. I discontinued that. No, they had their on the other parenteral feeds. I discontinued the regular parenteral feeds, put on the super greens, and then I started weaning medications. And so we detoxed her in the hospital. Progressively, the kidneys improved, liver improved. She started making lots and lots of mucus coming out of the lungs. That told me that the lungs were detoxing. The respiratory therapist could hardly keep up with suctioning. She eventually walked out of the hospital. That was an impressive case to me because, she was in a very slippery slope. When your liver and kidneys are failing, you're developing an acid base. But we loaded her with superfoods. Fortunately, her gut was well enough to absorb it, and being in the liquid phase. And I want to point out, if you look at my food classification system, people often ask, why do you make smoothies and juices level 0? We think we should chew our food, etc. That's one reason why. The sickest of patients will not be able to chew their food. She was not able to chew leafy green salads. She needed to have liquid juices, greens, fed through the peg tube. And in that state, that's the food you need. That's why I give that the highest ranking. And so we got her to a point where she recovered and walked out of the hospital. That's the most amazing case that I see in my career.
I love the fact that you said that she walked out of the hospital. That to me speaks volumes, from going from being in such dire straits to being able to walk out of the hospital. That is one heck of a transformation.
Yes.
Dr. Montgomery, in the time remaining that we have, I want to shift back and take a look at COVID-19. If you could pull up your slides that you have put together for that as well. And again, if you're hearing the audio version of this, just head over to the virtual Fairfax VegFest Facebook page or the Physicians Committee's Facebook page, and you can actually see this presentation. But Dr. Montgomery, if you could kind of walk us through your food prescription for the coronavirus, that would be fantastic.
Yeah, just a couple of things on the immune system. And I've given talks on this before. For the sake of orientation of your group, I tend to think of the immune system as two basic parts. You have the innate immune system and the adaptive immune system. And really, it's very simple. Your innate immune system is your skin. You have physical barriers, skin, GI tract, eyelashes. These are things that really protect you from foreign agents. We often don't think of them as part of the immune system, but if you think of burn patients, people who have severe burns through large parts of their body, they're at high risk for dying from infection because of the loss of their skin. And people with gastrointestinal problems are at increased risk for infection. So, these are some of the barriers that are important. They have defense mechanisms such as sweat, secretions, mucus, and their general immune response. Their leukocytes, which are inflammatory cells of different types. They communicate through other chemical reactions. And so they communicate with each other when a foreign agent passes the physical barrier, gets inside the body, and certain activities done. They also communicate with the adaptive immune system, B cells and T cells. They have their own chemical receptors and chemical modulators that communicate with other cells. They also create the antibodies that gives you specific immunity. So if you look at the balance, I like to think of things in balance. So things such as reactive oxygen species, these could be generated through metabolism. When you exercise, you create these chemicals. They can be created by your immune system. So these so-called negative chemicals can be beneficial in many ways, and they're part of our normal physiology. So they have to be balanced by what we know as antioxidants. These prevent free radicals from damaging the cells. And if you have lots of free radicals that are roaming around freely, they can damage the heart tissue, the immune tissue, pancreas. And so that's why we develop these chronic illnesses. And these are found in raw fruits and vegetables. So what you want to do is you want to have a balance between your antioxidants and your reactive oxygen species. So on the left of subset A, you have the scales of justice here. You have an equal balance of the reactive oxygen species and antioxidants. However, if your diet is poor, then you can have an imbalance. So if you have more reactive oxygen species than antioxidants, you're eating fried chicken, you're eating pizza on a regular basis, processed oils and the like, then you can have excess reactive oxygen species. You're in a condition of oxidative stress. I'm not sure if any of your listeners are barbecuers, but you know, in Texas, a big place in barbecue, and over 20 years when I used to do that, you get your barbecue coals hot and you have the smoldering coals. So you have smoldering hot barbecue coals and they're smoking. So there's a fire, but not a flame. But if you take some starter fluid, lighter fluid, and spew it over the coals, you then get a woof of flame. So essentially, the coals is an oxidative stress. That's where the hot coals are flaming, and you have, it's a potential setup for a flame. And all you need is some kind of a trigger. That trigger could be a viral infection. That trigger could be maybe a bad meal that has excess toxins. It'd be a cigarette or an emotional event that happens that acts as an igniter of that oxidative stress and woof, throws it in flame. So that's where you have an acute event. The acute event, like that flame in the barbecue pit, could be a heart attack. It could be decompensated heart failure. It could be decompensated lung disease or an asthma attack, or hey, a viral infection that puts you in the emergency room. So what you want to do is you want to prevent that from happening and keep yourself in balance. So if you consume lots of junk plus an infection, that puts you at risk for worsening oxidative stress and imbalance, and then that puts you in the hospital. That's why those people are sick. And so that's why we're treating our patients raw fruits and vegetables only, superfoods. I had a patient admitted to the hospital just a few weeks ago. He was transferred from another hospital, my hospital, bad decompensated heart failure. I put him on an intravenous vitamin C. We put him on a raw diet. His lactic acid went from a 16, which is extremely high, down to 1. His kidneys started failing. They turned around and improved. His heart pumping function improved. We were able to remove him off the inotropic drugs. So just by hitting the body with these antioxidants, even in the acute illness state, you have time to reverse these things because you're putting things back in balance. So here's some things you want to consume: vitamin A, vitamin C, vitamin E, selenium, zinc, glutathione. All of these can be found in your plant food kingdom. We recommend our patients for COVID-19 obviously follow CDC recommendation, seek medical attention as signs and symptoms dictate, and consume your minimally processed plant-based diet. And I'll leave you there with some of our programs, our website, our YouTube channel. We have some of these. The case of the individual is on our channel, montgomeryheart.com//YouTube. You can see lots of our information and online boot camp. I'll stop the share and send it over back to you.
Yeah, well, I greatly appreciate your time today. You've certainly opened our eyes to a lot of things, hit us with a whole heap of knowledge. And I know that you've created something special for those who are watching today, those who are listening. You are offering a discount for your online nutritional boot camp?
Yes, sir. The online nutritional boot camp is online.montgomeryheart.com. And if you type in the promotion code Fairfax VF, that's capital F, lowercase AIRFAX, and capital V and capital F, you get $100 off the program. It's an annual subscription, and this is the program we've used over 16 years. This is a program where we've shown the scientific evidence. What we've done is made this program available. That it consists of me going through the series of week to week and walking through the detox. There's some of course, recipes, but we actually walked it through in their lectures, and I talked about the mechanism of detox, talked about the nutritional value of a detox regimen, and the like. And we had some very good success. There's one gentleman who recently went through the program. He was already a vegan when he started, and his cholesterol is still high, but his total cholesterol went down significantly. Triglycerides, which were high, went down by 60%. Triglyceride to HDL ratio, which was a sign of his insulin resistance, went down by 60%. And he felt much better. He was feeling some symptoms of angina with climbing stairs. And then after doing the online program, these symptoms completely went away.
That is fantastic. And I know that a lot of people watching this right now and listening to this are grateful for the coupon code, and know that this is a great way, maybe not just for your own health, but certainly you can get your friends and your family involved in that, because that's really what this is about, is, making the world a healthier place, one person at a time. So let's spread that knowledge out there. Clearly, Dr. Montgomery, you know exactly what it is that you are talking about, my friend. This has been a very enlightening hour, and I can't thank you enough for joining us.
Well, thanks for having me. I enjoy your questions. Always a pleasure, Carol.
All right, my friend. And you stick around if you are watching this on Facebook right now. Coming up in just a little bit, we're going to be speaking with Gene Bauer from the Farm Sanctuary. How are the animals holding up right now during this COVID-19 outbreak? We're going to find out when we talk to Gene in just a little bit.